Hi, Daniel here from Australian Imaging, just having a chat with one of our good clients, Dr. Dev Boparoy at First Bite Dental. Dev, I just wanted to get a bit of a testimonial, I suppose, from you, just to find out your experience with using this system here, the KaVo OP3D with lateral Ceph, and a bit of your experience about the ownership and coming into the practice. So I suppose the first question I'd ask is, again, how have you found this higher end technology? Now, I know you guys had OPG here previously. I think it's your second or third cone beam. But what are your thoughts on the KaVo OP3D system?
Well, coming to a practice where we had a pre-existing lateral Ceph and an OPG, and then upgrading to a 3D cone beam, and then further going forward from that, upgrading to the KaVo, you can see the drastic improvement in image quality, the way we diagnose treatments. Like in our practice at First Bite Dental, we do a lot of orthodontics, we do a lot of implants, we do a lot of Invisalign. So we do need the capability at our at our fingers, right, to be able to on the spot diagnose and be able to explain to patients what are your options. And that has been a significant game changer in the way we practice dentistry, the way we convert patients, the way our patients accept treatment, and it's like I said, been a game changer.
And again, you were saying to us before that you guys have had a few. So you started with panoramic.
Yeah.
You went to cone beam. You're on, as I said before, we're on the second or third cone beam here. Is the image quality different between the systems that you've seen out there on the market?
Significantly. I mean, the KaVo system that we were on the market for an OPG 3D cone beam for a while. We investigated multiple companies, and not only was the service above par, excellent service in fact, the quality of the images and the training that went into it is actually excellent as well. So we found all around the experience from the moment the first conversation started till today has been quite seamless.
Yeah, and obviously having Dr. Steve Cross has been of help to you, I suppose.
Well, that's correct. And with the study clubs that you guys are running and all the information being passed around, there's lots to learn in this world of 3D imaging.
Okay, and would you give any hot tips to anybody looking at buying this system? Obviously, this covers every aspect. It's obviously a real contender for any dentist business right at the moment, checking out any machines. But any helpful tips, or what would you say to a good friend of yours that would be buying this machine?
Well, I would say, number one, choose a machine that is going to fit your needs, but at the same time also choose a machine that is able to accommodate future growth. Being able to have the lat Ceph function, to be able to have the airway function, being able to go for the larger field of view option. Always, anticipate that you will utilize this machine more significantly than what you anticipate. So plan for it.
Excellent. Thank you very much for your time today, Dev.
Thank
Cheers.
you.
Bye.